Colon cancer. It's a silent predator, often hiding deep within your body without giving any noticeable clues until it's too late. This insidious disease, marked by the uncontrolled growth of malignant cells in the colon or rectum, can affect anyone, regardless of age, gender, or background. But here's the truth. Colon cancer is beatable when caught early. In this video, we're breaking the silence and uncovering 8 critical symptoms of colon cancer that must never be ignored. These symptoms are your body's distress signals, its way of shouting, "Pay attention." Early detection can mean the difference between life and death, so don't ignore these signs. Colon cancer is one of the most common cancers worldwide. According to the American Cancer Society, it's the third most diagnosed cancer for both men and women in the United States. Even more alarming, it's a leading cause of cancer-related deaths globally. However, the fight against colon cancer starts with awareness. Knowledge is power, and today you'll gain the knowledge to protect yourself and your loved ones. Let's dive deep into these 8 silent symptoms that might just save a life. Symptom 1. Blood in stool. Have you ever noticed blood in your stool? While this can result from something as common as hemorrhoids or anal fissures, it's also one of the most common warning signs of colon cancer. Bright red blood usually means the bleeding is happening near the rectum or anus. This can be caused by swollen blood vessels, known as hemorrhoids, or small tears in the anal lining called fissures. However, dark, tarry stools may indicate bleeding from higher up in your digestive system, potentially from the colon or stomach. What's tricky is that blood in the stool isn't always obvious. It might appear as streaks or be mixed in with the stool, making it harder to spot. This is why being vigilant about changes in your bowel movements is critical. Takeaway: if you see blood in your stool, even once, don't ignore it. Seek medical advice to rule out serious conditions. Symptom 2. Abdominal pain or discomfort. Abdominal pain is common, but it's important to pay attention to persistent or crampy discomfort, especially in the lower abdomen. Colon cancer-related abdominal pain is often intermittent, but can become constant over time. It may feel like bloating or sharp cramps, and in some cases, it's paired with other alarming symptoms like blood in the stool or unexplained weight loss. Of course, not all abdominal pain means cancer. Conditions like IBS, gastritis, or diverticulitis can also cause discomfort. However, the key is noticing patterns or combinations of symptoms. Takeaway: if your abdominal pain doesn't improve or keeps recurring, especially with other symptoms, consult a healthcare provider. Symptom 3. Unexplained weight loss. Losing weight without trying might sound like a dream come true, but in reality, it's a serious health concern. If you've dropped more than 5% of your body weight within 6 to 12 months for no apparent reason, take it as a warning. Colon cancer can lead to weight loss by interfering with nutrient absorption, making your body burn calories faster. Another factor? Cancer triggers an immune response that speeds up metabolism, contributing to unintentional weight loss. Takeaway: unexplained weight loss paired with other symptoms should always prompt a medical evaluation. Symptom 4. Fatigue. We all feel tired sometimes, but cancer-related fatigue is different. It's crippling. It doesn't go away with rest and can affect your daily life significantly. Why does this happen? Colon cancer can lead to anemia through chronic gastrointestinal bleeding. Anemia reduces your red blood cell count, limiting your body's oxygen supply and leaving you exhausted. People with colon cancer often describe this fatigue as overwhelming, accompanied by weakness and a lack of energy. Takeaway: if you're feeling unusually fatigued, especially alongside other symptoms, don't hesitate to speak with a doctor. Symptom 5. Anemia. Anemia is more than just low iron levels. It's a sign your body might be struggling. Colon cancer can cause hidden bleeding in your digestive tract, which slowly drains your body of blood over time. This leads to iron deficiency anemia, which comes with symptoms like pale skin, shortness of breath, cold hands and feet, persistent fatigue. If left unchecked, anemia can worsen, reducing your overall quality of life and complicating treatment. Takeaway: if you've been diagnosed with anemia, make sure your doctor investigates potential causes, including colon cancer. Symptom 6. Rectal bleeding. Noticing blood after a bowel movement is always concerning, but the source of the bleeding matters. Bright red blood typically indicates bleeding near the anus or rectum, while darker blood suggests an issue deeper in the digestive tract. Colon cancer can cause tumors that bleed intermittently, which may show up as streaks in your stool or dark tar-like stools. Persistent or severe rectal bleeding is a serious warning sign that demands immediate attention. Takeaway: don't dismiss rectal bleeding as just hemorrhoids without seeking medical advice. Symptom 7. Chronic constipation. Constipation happens to everyone at some point, but chronic constipation is different. It's defined as having fewer than 3 bowel movements a week for an extended period. Colon cancer can obstruct your digestive tract, making it difficult to pass stool. This type of constipation might also come with abdominal pain and changes in stool shape or size. It's important to distinguish between occasional constipation, caused by diet or stress, and chronic constipation that persists despite lifestyle changes. Takeaway: If you're experiencing prolonged constipation, get checked by a healthcare provider. Symptom 8. Chronic diarrhea. While constipation raises red flags, persistent diarrhea can be just as concerning. Chronic diarrhea involves frequent, loose, or watery stools that last for weeks. In some cases, colon cancer can irritate the lining of your digestive system, leading to diarrhea. This symptom is often overlooked, especially if you assume it's related to food or stress. However, long-term diarrhea can lead to dehydration and nutrient deficiencies, so it's crucial to address it. Takeaway: if diarrhea becomes a constant issue, don't ignore it. See a doctor to find the root cause. Prevention and early detection. The fight against colon cancer starts with awareness and vigilance. Spotting these symptoms early could make all the difference in successful treatment. Here's what you can do. Get regular screenings. Colonoscopies can detect and remove precancerous polyps before they turn into cancer. Know your risk factors. Family history, age, and lifestyle choices all play a role in colon cancer risk. Listen to your body. If something feels off, don't hesitate to seek medical advice. Take control of your health. Your health is priceless, and being informed is the first step to protecting it. By recognizing these 8 symptoms, you're equipping yourself with the knowledge to detect colon cancer early and take swift action. This video is for informational purposes only and not a substitute for professional medical advice. If you or someone you know is experiencing these symptoms, please consult a healthcare provider immediately. If you found this video helpful, please give it a thumbs up and share it with your friends and family. It could save a life. Don't forget to subscribe and hit the notification bell for more valuable health insights. Thank you for being part of our community. Together, we can stay informed, stay vigilant, and beat colon cancer before it's too late.